Okay, start.
Yes, sir. Thank you for the topic. The topic is religion and health. So, religion is one of the social determinants of health. Religious plays an important role when it comes to access to the healthcare. In India, India is a diverse nation which has diverse population. So it needs a diverse kind of healthcare facilities, considering the religion, caste, creeds, and geographical areas. So religion plays a role when it comes to some rigid practices. So usually in the rural areas or in some remote areas, there are some of the practices which are traditional or indigenous to their area, which inhibit them to go into the hospitals or any kind of other practices that will hinder their health. So another thing is, if we talk about the religions which in India or Hindu, whether it is Muslim, Sikh, like that. So based on the religion, there are some practices like they have more alcohol consumptions or more tobacco consumptions. At the same time, some of the religion practices, like whether if they are vegetarians, they have some practice, and if they are more into like non-vegetarians, they have the. So in these kind of in these kind of practices, it impacts on the health, especially increase of this non-communicable diseases. If we see in India, because of the increase of this transition from the food changes, the wholesome food that we are used to eat, now it has become more processed and has high salt and sugar foods. So because of these, we have the increase of these non-communicable diseases. At the same time, the religions plays a role when it comes to the even the mother and child health, when even in the mental health also. So there's some practices in Jainism has which control our mental status, which has a very good impact on even eating habits also. At the same time, some religion have some they have condition with eating of high fats, high non-veg, which will impact their prevalence of the non-communicable diseases like hypertension, diabetes, and even which also lead to the non-alcoholic fatty livers, and it may leads to mortality and morbidity. So in India, India has a diverse nation, so we should address based on the community needs. So health system should be robust in such a way that it should
Okay, okay.
break the.
Chitra, okay, fine. So, the thing that we were talking about, that any religion which promotes non-vegetarian foods, there is a lot of chance of getting hypertension. So, is this fact which you are talking about, it is just your observation, or do you have any data regarding this? Like people who consume more non-veg, they
Yes.
also they are prone to hypertension and such diseases which you are talking about. Is this a research or fact or just
Sir,
observation by you?
Sir, it is my observation. At the same time, there are facts. Some of the surveys which were, I don't know the exact data, but there was a survey about this, why in India the increase of this non-communicable diseases is happening because of more consumption of the meat, which has a high fatty acids, which is have a high cholesterol and high triglycerides in it. Because of this, there is an increase of this obesity in the.
Does it match with other country which has similar eating habit, or even they consume more meat? So spread of these non-communicable diseases are also there, or it is well universal fact, or it is just being observed in India and people are speculating that it might be because of the meat consumption.
Sir, it is all over the world. It's not only in India, but we can't say the only meat is responsible for increase of these non-communicable diseases. There are other factors like other processed foods what we eat or other high cholesterol diets what we have. So all factors conclude to increase these things. We can't say only meat is increasing the obesity or non-communicable diseases.
Okay, in recent times we are getting news that people are getting heart attack in the marriage functions, while dancing, even in class, exam hall. A lot of young people are also dying because of it. So, I think matlab, like government is still not very sincere about this, but probably public health infrastructure should take care of, not should take care of it, but should be working in some of the mechanism to get control on this situation. So can you tell me what could be done here as a policymaker?
Yes, sir. Basically, sir, the increase of this cardiovascular diseases is it has so many factors. It starts from the diet, exercises, what kind of lifestyle we have. So everything matters when it comes to these CVDs, obesity, or it is hypertension. So there is no particular cause, etiological factor for this. And
But Chitra,
when it
there must be something which are instigating the process, because before COVID or before matlab 5-10 years before, there was no such instances. People usually after 40 or 45 they used to get heart attacks, and such incidents happens.
yes, sir.
But these days a lot of young people are also dying, and matlab some all of these news are being reported, then only you know.
Yes, sir.
There may
Yes, sir.
be a number of cases which might be unreported also. So you cannot just make the same kind of assumption over these diseases, that well of these cases which you are talking about, which we are talking about. As a policymaker, should you not focus on finding uh, anything extra which is there, which is causing these events? Are you not getting me? Hello, hello, Chitra, are you not listening me, or hello, hello, hello?
Yes, sir. Definitely, sir. After COVID-19. Yes, sir. Yes, sir. Sir.
So what should be done? Matlab, like, what should be the strategy ahead?
Hello, sir. Will you please repeat? It was this thing,
And
lack of.
I was saying that there must be something else which has come up other than what you were talking about. So as a policymaker, should we not focus on finding the reason rather than generalizing it that it is happening due to all those factors which were already there since
Yes, sir.
always? So now
Sir,
tell me the policy interventions, what could it be?
so policy interventions mainly in addressing the people about the food also at the same time. After COVID, there are some of the side effects of
अच्छा
COVID.
ओके चित्रा, मैं क्या कह रहा हूँ कि वी नीड टू research. Research is a big thing that we always should keep in our mind, because in these cases or any such cases, we cannot just assume uh,
Yes, sir. Yes, sir.
anything on the basis of previous research. तो जब भी पॉलिसी इंटरवेंशन की बात हो, तो इट्स नेसेसरी टू डू प्रॉपर रिसर्च दैट वेदर it is happening due to the same reason. Maybe your research may not find out the exactly. Maybe the number of events that happened and I may not be very open-ended, so that you can easily pick or find what are the reasons that made this happen. But still, you have to do the research.
Yes, sir. Definitely
Because,
research.
huh,
Yes, research plays a very role to
so
know the real cause of increase of this.
exactly. Even if you'll not know the real cause, you might have some the extra data for the next research. है ना,
Yes, sir.
क्योंकि यू हमेशा एक बार में रिसर्च आपके सारे क्वेरीज को वो कर दे, सेटिस्फाई कर दे, ये जरूरी नहीं है. जब भी आप बड़ी पॉलिसी पे काम करते हो, तो यू हैव टू बैक विथ द रिसर्च डेटा. ओके.
Yes, sir. Sure, sir.
तो सीधा अवेयरनेस स्प्रेड करना या सीधा ही, क्योंकि वो तो हम पहले भी कर रहे हैं, अब भी हम चाहते हैं कि लोग समझें कि लाइफस्टाइल डिजीज हैं ये, यू
Sir,
नीड
I
टू
think
कंट्रोल ऑन योर डेटा.
Yes. Sir, but what I think is the education and awareness is lacking in India, whether it is non-communicable or communicable.
ठीक है,
Uh,
मतलब वो तो जनरल केस के लिए भी है. मैं तो वो
yes, sir.
स्पेसिफिक उस केस की बात कर रहा हूँ कि जो रिसेंट इंस्टेंसेस हुए हैं वेयर यंगर पीपल आर गेटिंग हार्ट अटैक. परसों भी एक न्यूज में आया कि somebody, अ गर्ल फ्रॉम दिल्ली, डेस्टिनेशन मैरिज के लिए नैनीताल गई थी, वहां पे डांस करते हुए उसको हार्ट अटैक आ गया, एंड शी वाज डेड. तो अब ये इंस्टेंस पे स्पेशली तुमसे पूछा गया है, तो तुम ऐसे ओपन एंडेड बात नहीं कर सकते, है ना?
Okay, okay, sir.
तो यू नीड टू डू द रिसर्च, देन यू विल इंटरवीन ओनली। तो वो आफ्टर द रिसर्च डेटा यू विल नॉट टेल अबाउट द पॉलिसी स्टेप्स और इंटरवेंशन स्टेप्स, बिकॉज जब रिसर्च ही नहीं है, जब आपके पास रिजल्ट ही नहीं है, तो कैसे आप बताओगे? लेकिन यू कैन ऑलवेज पिच फॉर द रिसर्च पार्ट, ठीक है?
Yes, sir.
चलो, नेक्स्ट बताओ जितना कि यू आर लाइक व्हाट प्रॉब्लम डू यू वांट टू सॉल्व, like after this course, do you have anything in your mind that I'll be working for this problem?
Yes, sir, I have. My interest is in tuberculosis. Because TB is a preventable and curable disease, still India has 27% of global cases, which is very alarming. Even though this TB is from years and we have the protocols or treatments to cure this disease, but still we are not able to do that much because of the transmission from one person to another person that is happening especially in the urban slums and in the remote rural areas because of lack of sanitation. I want to work on this. The in 2024 the leading thing is this thing drug resistance, that is called multiple drug resistance, which is becoming common in this tuberculosis because of firstly because of the people neglect when it comes. They thinks that it is a no it they yeah, so they don't go for screening. They ignore or they misuse like this is not this is any common ailments like that they will treat. And because of that there is increase of spreading to the first contacts. So that is happening in India, so that need to be regulated through the policy interventions and research.
So is it not being done by the current health policies?
Yes, sir, it is done. Recently in 2021, Nikshai portal, they launched this portal and they launched this Nikshai portion also to improve the nutrition in this TB patients. But it is not up to the mark. Still, we are facing the issues when it comes to tracking the patients because of the migration, or if they get healed in within 3 or 4 months, they stop taking medicines. Because of that, they are getting this multiple resistant tuberculosis. This need to be properly addressed, sir.
Okay. So which state has highest TB patient in India?
Sir, currently, sir, I don't know the data, sir.
You don't know.
I think, sir, it is Madhya Pradesh. I'm not sure, sir, actually.
So you find that TB is a very matlab, uh, critical, not critical, is important to take care of.
Yes, sir.
What are the other disease that is very alarming situation of that is very alarming in India?
Sir, another disease I consider is one of the which is important and threat is anemia, which is more prevalent in adolescent girls and mothers and even children also. There was a in 2023 a global hunger report. It states that in India, 57.4% of women and adolescent girls have anemia. Like this is very alarming because anemia acts as it is like a magnet. It attracts all the diseases. So that person will be more susceptible or immune compressed, so compromised if that person has anemia. So I think this is also one of the important disease.
And what is being done for this anemia?
Sir, government has launched recently in 2020 that Poshan Abhiyan 2.0 integrating the Saksham Anganwadi. Through this, they are providing fortified foods for the children from 0 to 6 years and for the pregnant mothers and adolescent girls also. They are providing the folic acid tablets. Along with that, they are awareing and educating the people to consume more nutrient food. Yeah.
So tell me what are you expecting from this course, like in learning part? What will you learn here?
Yes, sir. Sir, in social epidemiology, I will be learning the epidemiological concepts, so which is a basis for the research. So research is a basis for every policy interventions. It will provide. It is a data driven systematic study where I will understand how the factors affect, especially the social factors affects the health when it comes to health. This will I will get to know this. Along with that, what is the progress of these policies? How efficient the policies in India currently are working? So I will be able to address those things. Through that, I can contribute in this public health.
You could have also talked about little about the MPH part also. Largely, you were talking about social epidemiology part. The course
Okay.
is MPHSE, na? So the entire public health infrastructure, its complexity, you know, and all the challenges. This will all be also be a learning part.
Okay, sir.
So tell me, if you'll get a chance to work in hospital after this MPHSE, so will you take that or will you still look for a job in social epidemiology sector?
Sir, the first thing why I come to this course is because I'm more interested in non-clinical aspects through my experiences in my UG life and even in internship. So I got to know many things related to the health, the social determinants which plays important role in health. So my interest is in this MPH, and I will look for the jobs in MPHSC only.
And what if you will not get placed?
Sir, I will definitely reach out to other alumni networks. I will get some reference from the teachers or any person who is all currently working in Masters in Public Health and try to. I will try to get any job. Yeah, yes, sir. Through that only I will do.
Okay. So have you applied for any other program?
Yes, sir. I was applied for other all MPH courses, but I was not
No,
able to.
matlab any other university for
Yes, sir.
MPH?
Yes, sir. I have applied for this IIPH Gandhinagar and CUETK this Kerala and even
Okay.
Azim Premji.
So what happened there? Matlab, like what are the
Sir,
uh,
I have selected in this IIPH Gandhinagar and even in Azim Premji. I'm in waiting list in CUEK, sir.
okay. So what is the number of your waiting list? Like what?
Sir, in CUEK,
Yes.
sir, I think 50, sir.
Can you compare the program of Central University of Kerala and TISS?
Yes, sir, definitely. TISS has it has a very different curriculum. If we see it combines both studies of this what is this classroom study. Along with that, we will be able to apply that knowledge in the practical study or practical curriculum. So this will improve us to gain the theory knowledge at the same time to gain how those can be applied in the practical form on field. So this will really help to develop the capabilities to address the ongoing challenges or to bring some research or evidence-based preventive measures in the public health. At the same time, in CUEK don't have this practical opportunities. They only have two practical internships, which is in third sem and fourth sem, and there is no this thing. There is no that much strong alumni network TISS has. At the same time, they don't have the this campus placements. So after completing 2 years of the course, we have to look for the referrals and we have to search the jobs there. But it is not the case with TISS. We have a strong alumni network. At the same time,
ओके
we
ओके। चलो
yeah.
इसमें इतना ज्यादा शिकायत नहीं करना है सेंट्रल यूनिवर्सिटी ऑफ केरला का कि टेस्ट के ही एक फैकल्टी मेंबर हेड करते हैं उसको। एंड दैट्स व्हाई इवन फॉर द वो इन श्रेया's इंटरव्यू दे वर आस्किंग अ लॉट अबाउट सीयूके।
हाँ
सो आई आल्सो आस्क्ड यू द सेम क्वेश्चन। अच्छा, कांग्रेचुलेशंस, तुमने ये बताया नहीं कि अजीम प्रेमजी वाले में हो गया तुम्हारा?
सर मैं मतलब मैं
That is a
नहीं
very good
जाना।
university. Matlab, now you need to be very confident uh, about the interview, because even if it is not happening in some मतलब in मतलब क्या बोलूं मैं, ऐसा कुछ भी हो जाता है, ऐसा कि कुछ दिक्कत होती है, but still you will have a very good place to study and work. एज फार एज मार्क्स इज कंसर्न, तुम्हारा कम्युनिकेशन इज ओके, जनरल अवेयरनेस इज ओके, मतलब जो सब्जेक्ट अवेयरनेस है, सब्जेक्ट अवेयरनेस इज ओके, मतलब यू नो व्हाट इज देयर इन सब्जेक्ट। एनालिटिकल एबिलिटी में थोड़ा कम देना पड़ रहा है, बिकॉज समहाउ यू आर नॉट अंडरस्टैंडिंग कि दिस क्वेश्चन हैज बीन आस्क्ड फॉर दैट पर्पस। तो अगर तुम्हारे दिमाग में वो चीज आ जाए ना, तो प्रॉब्ली विल बी स्पीकिंग इट बेटर वे।
ओके।
और बाकी सब भी ठीक है। तो अब मुझे लगता है कि 70 + 70 to 75 के बीच में तुम्हारा ये वाला होगा। रिलीजन हेल्थ में यू आर नॉट फाइंडिंग द, मतलब वो भी ठीक था, बट एक दो चीजें तो तुमने फाइंड किया, बट कुछ कुछ और भी चीजें यू कुड हैव आइडेंटिफाइड विच इज वेरी इंपॉर्टेंट। जैसे जैसे हिंदू रिलीजन में फास्ट का जो कंसेप्ट होता है, या फिर और सारे
ओ
रिलीजन
यस
में,
सर, फास्टिंग।
फिर कुछ रिलीजन में मतलब जैसे विद इन द फैमिली मैरिजेस का वो है, तो उससे भी लॉन्ग टर्म जेनेटिकली वो होता है ना, मतलब डिग्रेड होता है ना।
यस सर।
वो भी प्रूवन फैक्ट है, तो
हाँ।
उसको भी बात कर सकते थे। फिर रिलीजन उस पे प्रेशर की वजह से जेंडर जस्टिस नहीं हो पाता, तो हेल्थ में भी वो ट्रांसफॉर्म हो जाता है, रिफ्लेक्ट होता है। तो ये
हम्म।
सब चीजें भी तुम बता सकते थे, ठीक है। तो
हम्म।
उसमें भी तुम 70 to 75 तुम्हें मैंने दिया, बट दैट कुड हैव बीन 90। और इंटरव्यू भी 90 जा सकता था, अगर थोड़ा सा तुमने और ध्यान दिया तो।
ओके सर।
ठीक है।